Before my diagnosis with breast cancer, I never thought I could get breast cancer. At the age of 36, I thought I was way too young, and then in the African American community, cancer's not really discussed. So I never thought that breast cancer could happen to me. When I went into doctor's appointments, I didn't see anyone my age, and I also didn't see very many African American men or women. I wanted a voice for African American women that were fighting breast cancer, and that kind of started my advocacy journey. Clinical trials is what makes or breaks what is new, innovative in medicine. It's what saves lives. One of the medicines I'm on after breast cancer went through a clinical trial, and they found out what worked and did not work, and here I am today, still cancer-free. Why I think it's important for the African American community is because a lot of times there's a lot of myths. A lot of things stem from generations of untruths and honestly being mistreated sometimes. But it's more important now because in clinical trials, we need everyone to participate so they can get the true results that they need for everyone. So breast cancer definitely made me make a switch. I went from healthcare into research and into clinical trials, and it's been amazing. I'm actually a research specialist at the University of Pittsburgh School of Nursing, where we actually recruit primarily African American and Caucasian women for research studies comparing and contrasting breast cancer. I'm also a clinical trial ambassador at Hillman with UPMC. With both of these roles, I can walk into the room and talk to a breast cancer patient and say, hey, I know you just see me as a researcher, but so you know, I've been through it as well. I hope that my story one day will change the future of breast cancer for men, for women, for young, and for old. I'm hoping that by being a voice in the spaces where people feel like they don't have a voice, that will finally be heard. And one day, maybe there won't be any more diagnosis. That one day we'll get to a place where breast cancer is a thing of the past. I believe it can happen.